Hi, my name is Jeanne Gillespie. I'm a medical lab technologist in a hospital microbiology department. I decided to do my major paper on the misuse of antibiotics in the United States. Here's a preview of what this PowerPoint's about. First, I'm going to talk about antibiotic resistance, then trends in drug resistance, how antibiotic resistance happens, common misuses of antibiotics, how antibiotic resistance spreads, fighting resistance, and then finally the antibiotic stewardship program. Antibiotic resistance is the ability of bacteria to resist the effects of drugs, which mean the drug used on the bacteria did not kill it, and the bacteria is continuing to grow in the body and infect it. Infections with resistant organisms are difficult to treat, requiring costly and sometimes toxic alternatives. Antibiotic resistance has become one of the most serious and growing threats to public health. In 2009, more than 6.5 million pounds of antibiotics were administered to U.S. patients, and 28.6 million pounds were given to animals, according to the New England Journal of Medicine. Another slide on antibiotic resistance. Improper use of antibiotics can cause drug-resistant bacteria and could even lead to death. And this is why it's important to properly use antibiotics. The overuse of antibiotics has allowed bacteria to rapidly evolve defenses, making some antibiotics useless against certain strains of bacteria. And some examples of those resistant strains of bacteria are Clostridium difficile, also known as C. diff, methicillin-resistant Staph aureus, a lot of people know it as MRSA or MRSA, carbapenem-resistant Enterobacteriaceae, also known as CRE, and also vancomycin-resistant Enterococcus. And just from my experience, I see MRSA constantly, and it seems to be more and more. And I also see a lot of VRE and, of course, C. diff. But thank goodness I have yet to see CRE. Trends in drug resistance. Antibiotics are among the most commonly prescribed drugs in medicine. Antibiotics can be life-saving, however, up to 50% of antibiotics are not optimally prescribed. Often prescriptions for antibiotics are given when they're either not needed for treatment or the incorrect dose or duration. Antibiotics are being used to promote growth in food-producing animals. The use of antibiotics in livestock is linked to increased ineffectiveness of current antibiotic treatment in humans. And this is a nice picture I found on the CDC website of how antibiotic resistance happens. In this first section, it shows a lot of bacteria, and these pink ones are a few of the drug-resistant bacteria. Then the patient gets put on antibiotics, and the antibiotics kill the bacteria that's causing the illness, but it did not kill the resistant bacteria. And it also kills the good bacteria in your body that protects it. Then in the third box, the drug-resistant bacteria are now allowed to grow and take over because all the other bacteria have now been killed off. And then finally, some bacteria give their drug resistance to other bacteria, which causes more problems. And the drug-resistant bacteria can also pass their resistant genes on to your good bacteria or your normal flora. Next is common misuses of antibiotics prescribed for non-bacterial infections. This is what antibiotics are supposed to be prescribed for. They're only going to be effective against bacterial infections. Yet still, they'll be prescribed for viral infections, which antibiotics will do nothing for, like the common cold is a virus, the flu virus, bronchitis, most sore throats. The majority of sore throats are caused by viruses, but some of them are caused by bacteria like group-A strep. But oftentimes, doctors will just give you an antibiotic because you have a sore throat, and he doesn't even know yet, or might not even have tested you to see if it's a bacteria causing the infection. Another misuse is antibiotics are prescribed prior to receiving lab results that identify the cause of the infection. For example, like I said, a doctor not even testing you for strep or seeing if bacteria is in your throat causing an infection. Also, providers are supposed to revisit the selection of antibiotic after results become available. So once the doctor received a throat culture seeing that it wasn't bacteria causing the infection, he's supposed to go back and either call the pharmacy, the patient, and switch their prescription. Another misuse is patients pressuring doctors for antibiotic prescriptions regardless of the cause of illness. Patients believe that an antibiotic will give them quick relief because, for example, before they had a sore throat and doctor gave them a Z-Pack and it cured them. So now every time they get a sore throat, they think that's what's going to cure them, even though a bacteria might not be what's causing the infection. Also, people can purchase antibiotics abroad or via the internet for self-diagnosing illnesses. And then finally, people use antibiotics to promote growth in livestock. And this is a nice picture again from the CDC website. And this is examples of how antibiotic resistance spreads. So you start with an antibiotic and say you give it to a patient. And then from the antibiotic, he develops resistant bacteria in his gut. And then let's say George stays home and in the general community, he spreads resistant bacteria to other people. Or George gets care at a hospital, nursing home, or an inpatient care facility, and resistant germs spread directly to other patients or indirectly on unclean hands of health providers. Or, when he's in the healthcare facility, resistant bacteria spread to other patients from surfaces within the healthcare facility. And then the patients go home, and then the patients spread to the general public, which I see, just in my experience at work, I see a lot of the same bacteria being shared between patients in certain facilities, like at nursing home. I'll see a really resistant strain on one patient, and then I'll see it on another, then on another, then on another. And that just gives you an idea that something's going on and that bacteria is definitely spreading to other patients. Another way is animals get antibiotics, like I said, to promote growth and develop resistant bacteria in their guts. And then either the drug-resistant bacteria remain on the meat from animals. When not handled or cooked properly, the bacteria spread to humans. Or fertilizer or water containing animal feces and drug-resistant bacteria is used on food crops. Then the drug-resistant bacteria in the animal feces can remain on crops and be eaten. These bacteria can remain in the human gut, then spread to the general public. And this is just some statistics. Here's the national summary data for the United States. Estimated minimum number of illnesses and deaths caused by antibiotic resistance, at least 2,049,442 illnesses and 23,000 deaths. Estimated minimum number of illnesses and death due to Clostridium difficile. And C. diff is a unique bacterial infection that, although not significantly resistant to drugs used to treat it, it is directly related to antibiotic use and resistance. So at least 250,000 illnesses and 14,000 deaths. And this says, where do infections happen? Antibiotic-resistant infections can happen anywhere. Data show that most happen in the general community. However, most deaths related to antibiotic resistance happen in healthcare settings such as hospitals and nursing homes. And this is a way of fighting antibiotic resistance. The single most important action needed to greatly slow down the development and spread of antibiotic-resistant infections is to change the way antibiotics are used. And antibiotic stewardship, this is a commitment to always use antibiotics appropriately and safely. And an example of using an antibiotic appropriate and safely is to use only when needed to treat bacterial diseases, like I said earlier, and to choose the right antibiotics and to administer them the right way in every case. Should be correct dose and duration. And this is a slide on the antibiotic stewardship program, which the CDC helped develop. A critical step towards stemming the tide of antibiotic resistance and ensuring patients are receiving the right antibiotic at the right dose at the right time. Antibiotic stewardship programs help to optimize the treatment of infections and reduce adverse events associated with antibiotic use. And it's proven that antibiotic stewardship programs improve the quality of patient care, improve patient safety, reduce treatment failures, reduce hospital rates of C. diff infections, and reduce antibiotic resistance. This is the CDC's 7 core elements of a successful antibiotic stewardship program. Number 1 is leadership commitment, dedicating necessary human, financial, and informational technology services. Number 2 is accountability, appointing a single leader responsible for drug program outcomes. Drug expertise, appointing a single pharmacist leader responsible for working to improve antibiotic use. And number 4 is action, implementing at least one recommended action. And for example, that would be providers revisiting patient drug information and test results 48 hours after their initial treatment and making adjustments accordingly. Number 5 is tracking, monitoring antibiotic prescribing and resistance patterns. Number 6 is reporting, regular reporting information on antibiotic use and resistance to healthcare providers. And number 7 is education, educating clinicians about resistance and optimal prescribing. And these are the sources where I found my information. And from researching on antibiotic resistance, I learned that with education and with better antibiotic practices, that we can greatly slow down the progression of antibiotic resistance. Thank you.